Hey everybody, this is Dr. Monica Dew here. I wanted to go on in and discuss with you all type 2 diabetes. In our previous segment, we spoke on type 1 diabetes. Of course, you all know from the previous discussion that is an autoimmune process. Now, what is the main difference between type 1 and type 2? Well, type 2 is not your autoimmune process, and this was formerly known as adult onset diabetes, but there has been increasingly, alarmingly so, rates of type 2 diabetes in our pediatric population. And this is often accompanied by unhealthy lifestyle, obesity, high cholesterol, increased sugar intake, sedentary lifestyle. A family history can also predispose you. Your particular genetic makeup, actually, studies have shown, can increase the risk for type 2 diabetes. It has also been found to be more prominent in certain groups as well. So, all of the above can increase the risk for type 2 diabetes, which is not that autoimmune process in which the body fights its own organ, the pancreas. In this case, we are having an inability of our pancreas to use its insulin appropriately, which can lead to what we call insulin resistance. And of course, as I discussed before, insulin is that special um, component in our cells that allow us to take up glucose and then therefore fuel ourselves efficiently. But with that type 2 diabetes, we do not use it well, and or the pancreas starts not to make it well either. So there is definitely a decline in the usability of the insulin, and then in and of itself there's also a decrease in the insulin production as the pancreas is no longer functioning as well as it should. And of course, that can lead to any and all of the discussed side effects that I told you about before. It can affect our vision, it can affect our heart in the long term. Of course, it can lead into even kidney failure, it can affect our nervous system, it can lead to neuropathies, all of those things that we definitely want to prevent. Now, what are some of the common signs and symptoms that you may see? You might find, just as in type 1 diabetes, an increased frequency of urination, increased thirst. Of course, the person may feel very tired and fatigued. They may actually have increased weight gain or weight loss, as we are not fueling our body efficiently and cannot therefore do the normal processes of growth like we would like to do. However, in some cases, some people may not even have any symptoms at all. That's why it's actually a silent threat to us. So sometimes people just actually get diagnosed after, some testing that was performed by their physician, and we just found out that there were abnormal numbers in either their blood glucose levels or in the factor that I told you about, which is the hemoglobin A1C testing, which tells us what our blood sugars are doing over a 2 to 3 month period. So sometimes people don't even have any symptoms, they just actually get it diagnosed from that happenstance blood testing done at their physician's office. So, it is a definite important illness that we need to be aware of because it can be a silent and then even fatal and deadly one. Now, just as in type 1 diabetes, of course, our management will definitely include a monitoring process. If someone is diagnosed with type 2 diabetes, we definitely want them to be seen by their physician regularly, at least every 3 months to 4 months or so, to make sure that our blood sugar levels are okay, our hemoglobin A1C is okay, and then of course we can look into other lab testing, such as our cholesterol. We can also look at other things that can be affected by our body habits, such as our blood pressure and so forth. These are all important things that need to be looked into. We may also need to add on annual vision testing to make sure our eyes are not being affected and so forth. So it's very important that if someone is diagnosed, whether it is type 1 or type 2 diabetes, we need our physician or, as I was telling you in our other segment, our endocrinologist to help us follow up on patients such as these so that we can prevent the terrible sequelae that can happen and the organ damage that can occur if our sugars are skyrocketing all the time. Because as I told you all before, blood sugars in high and excess within our bloodstream is not healthy for us. So we definitely want our physician to help us keep us under control, and then in terms of treatment options, decide whether we need to start a medication or not. Now, insulin is one of the main medications that may be prescribed by your physician, but it's all dependent on the blood glucose levels and how we are doing overall in our whole body picture. So that may be given to help stabilize the glucose levels throughout the day. In addition, there are also other medicines that are out there, quite a few, even some new ones, but one of the main ones help to um, promote better glucose metabolism from the liver, and then also help to increase the insulin sensitivity to the cells so that we have a better balance of our glucose within our system. So that might be one that the physician may choose to give. And then in addition, it is so important that someone diagnosed with type 2 diabetes see their physician on a regular basis. Make sure if you know of someone or your child has type 2 diabetes, ensure that they are having regular checkups because that's the only way that we can determine if something needs to be changed, if something is not right. And that's going to be through checking something called the hemoglobin A1C to make sure that their blood sugars are okay overall, and then checking their urine, also ensuring that their vision will be checked, making sure that their skin is fine because just as in type 1 diabetes, it can lead to poor wound healing, it can lead to infections and so forth. So there are quite a few things that need to be done at least in 3 to 4 month intervals. You can do with your pediatrician or endocrinologist, and then annual visits such as your vision checks to ensure that everything is okay. In addition, make sure to provide a healthy living and lifestyle for your children because this is the main thing that's causing us to have all of the increased cases of diabetes. Our lifestyles are not healthy, so ensure a nice healthy diet, well-rounded nutrition, fruits, veggies, less fats, less greasy foods, less processed and takeout foods. Cook more at home. I know it takes a little time, but I'll tell you, believe me, it is definitely a big help for you and your child to live a healthier lifestyle because you are able to determine what exactly you're putting in your body. You know how much sugar you're using, you know how much salt you're using, and so forth. So definitely cook your meals at home if you can, and that would be a big help to you. And then live actively. You can even take some walks with your children outside, have them go out, get some fresh air, less of the sedentary things like the video game playing and the TV watching throughout the day, more physical activities for all of you as a family. Do it together so that you all can live a healthy lifestyle. All right, I hope that that was helpful to you. You know, diabetes is something that we definitely want to be aware of, and if we can, take control of because, you know, the sequelae can be fatal and something, at least in type 2 diabetes, that we can prevent. All right, I will see you soon.